the coronavirus death toll in the U.S. rises to 11, and President Trump is ramping up efforts to combat the illness. I do want to now bring in Dr. and Kansas Congressman Roger Marshall live from Capitol Hill to talk more about the efforts to combat the outbreak. Hi, Congressman. Thanks for joining us today.
Hi, Greta. Thanks for having me on. Look forward to a great conversation.
Today's vote, you were just there in the chamber voting on that. It secures more than $8 billion to fund efforts to fight the coronavirus. Where does that money come from, and how will it be used in this effort across the U.S.?
Well, certainly this president and this Congress are committed to protecting Americans, and I'm looking forward to seeing exactly how we can use this money to the betterment of people across the country. There's about $4 billion here to develop vaccines, to develop antivirals, as well as get more diagnostic kits out there. We already have some 15,000 kits across 38 states. By the end of this week, we're going to have 75 diagnostic kits, and maybe 75,000 by the end of this week, and maybe 1 million by next week. So this money will be put to good use.
I understand that you yourself have been receiving updates from the CDC and the HHS about their efforts to fight the outbreak. What's the latest they've told you about their efforts there?
Well, I think we're happy where we are right now, the relative containment of the virus. We certainly knew this virus was going to go into this country. I think so far our processes are working. You know, for years we put together preparedness drills, getting ready for a moment like this, for a possible pandemic. I think our local county officials, our county public health departments are doing a great job. Doctors and nurses across the country doing a great job as well. So we're very happy. I think we're excited to see how far we are in some type of an antiviral. I think we're a little bit further along than we would be with that medication. I think there's some promising news from that front as well.
Your district back at home in Kansas is home to the National Bio and Agro Defense Facility. What role can that facility play in researching COVID-19?
Well, in a disease like this that probably came from an animal and jumped over to a human, that's exactly what their specialty would be, is protecting America's food sources. And then when there's a virus like this, especially when it takes on both animals and humans, maybe we would have already had some research done that would help figure out the antidote, figure out the vaccines as well. So this will be right up their alley.
This, of course, has been a bipartisan issue for lawmakers there in Congress to stop the spread of the coronavirus here in the U.S. What's the message you've been hearing there on Capitol Hill among your colleagues on fighting this outbreak?
Well, I think number one, that this is a time to be prepared. It's not a time to panic. So this is a time that we're all trying to get a message to our folks back home, is you need to be making a plan. So working with your local county public health officials, whether it's a workplace or whether it's a place of worship or where your children are going to school, that your community needs to have a plan, that if a person is suspected of having this virus, how are they going to be tested, and how are they going to be isolated so we can contain the virus, track down those contacts as quickly as possible. You know, every week our public health officials do a great job tracking down communicable diseases. This will be one more example. So we need to make sure that the public is well aware of what to do if they think that they come in contact with this virus.
Congressman, you yourself are a doctor, and one message that's been swirling about this virus is the possibility that it can spread through what's called community spread. Explain for our viewers what that exactly means.
Well, I think that when you think about the seasonal flu, that is just spread through the community as opposed to coming from the outside. The people that were in China that flew back here, or they were on the cruise ships, we wouldn't necessarily consider that community spread. But when it comes back to this country and it goes from person to person, and we really don't know who started that process, who started that domino. And that's why it's important that all of us do the common sense things, wash our hands, try to not go into crowded places. If you think you're sick, stay home for a day or two. You know, if you've been traveling out of the country, I wouldn't go to a nursing home. Some common sense prescriptions is what I would recommend.
All right, Kansas Congressman Roger Marshall joining us live from Capitol Hill to talk about the latest efforts to combat the coronavirus outbreak here in the U.S. Again, the House has voted to pass that $8.3 billion spending bill for that effort. That's moving on now to the Senate, likely to be sent to the president's desk. Thanks so much for coming on the show today, Congressman.
Greta, thanks for having me on.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.